This video is going to demonstrate the immobilization of a long bone injury. Gather your equipment. Your equipment may vary. During the video, yellow text will highlight critical criteria set by the NREMT. You will start your scenario by stating BSI is MyScene safe. This will ensure that you are wearing the proper PPE, personal protective equipment, and that your scene is safe. BSI is MyScene safe. First, have your patient manually stabilize the injured extremity. Next, check your patient's circulatory, sensory, and motor functions. Checking pulse. Can you feel this?
Yes.
Wiggle your fingers. Next, you will take the splint and correctly measure the length. Then, while supporting the patient's injured extremity, place your splint with minimized movement. Next, place your patient's hand in the position of function. Next, you will secure your patient's injured extremity to the splint utilizing either cravats, roller gauze, or in this case, ACE wrap. Make sure that as you secure your patient to the splint, that you minimize movement of the injured extremity and you leave a window open or access to the radial pulse. Next, you secure the entire extremity with a sling and swath. Take a swath, place the longest end at the patient's injured extremity at the knuckle, with the pointed end, the short end, at the patient's injured extremity at the elbow. You will take this measurement at the elbow, tying a knot. This knot will create a pocket to secure the injured limb. Next, while supporting your patient's injured extremity, you will place, with the cravat in hand, place the sling underneath the patient's arm. As you do this, the patient will move their hands from underneath the cravat to on top of the cravat. Next, you'll take the back end of the patient's sling, the one that's hanging down, and place it over the patient's shoulder, in between the patient and the injured extremity. Next, secure a knot behind the patient's neck of the sling, making sure to stay off of the spine. Next, you will take your secret cravat. This will be utilized as a swath to secure the injured extremity to the patient's body. Some patients require more than one. Be sure that as you secure your patient's sling, that you do not include or secure the unaffected limb. You can do this by placing the swath in between the patient's body and unaffected limb. When securing the swath, be sure not to place the knot near or on the spine. Next, I'm going to reassess my patient's circulatory, sensory, and motor functions. Checking pulse. Can you feel this?
Yes.
Wiggle your fingers. You will now transport your patient. At this time, your evaluator will tell you to clean up your station and return to class.
This skill will evaluate your ability to immobilize a long bone injury.
BSI, is my scene safe?
Scene is safe.
First, I'm going to have my patient go ahead and stabilize the injured extremity. Checking patient CSMs. Checking pulse.
Pulse is present.
Can you feel this?
Yes.
Wiggle your fingers. Measuring the splint. Support my patient as I place the splint. Placing my patient's hand in position of function. Measuring the swath. Patient, as I place the sling, please move your hand from the inside to the outside of the sling. Making sure to place the knot away from the spine. Securing my patient's swath. Making sure to avoid the spine. Checking my patient's pulse.
Pulse is present.
Can you feel this?
Yes.
Wiggle your fingers. At this time, I'll transport my patient.
Okay, at this time, clean up your area and head back to your classroom.
Yes, sir.